Hello, and thank you again for joining us. The I-270 I-495 project is back in the news this week. Last Friday, Governor Hogan announced the Federal Highway Administration's intent to delay the decision on the I-270-495 toll project to allow for a deeper review. Last month, I sent a letter to Secretary of Transportation Pete Buttigieg asking him to allow more time for review of this overly complicated and expensive proposal. 24 members of the county state delegation also asked for additional time. I believe that this additional time will actually get us to a better project. And I was pleased that the Baltimore Sun wrote an editorial this week agreeing that a short delay now will likely get us a better product as a result. When Governor Hogan first proposed this plan, I repeatedly credited him for trying to come up with a plan to address the problem on I-270 and 495. However, I also pointed out and continue to point out the need to improve the plan. Early on, I said the plan needed to begin at the choke point of the American Legion Bridge, and it had to be a complete solution all the way to Frederick. Unfortunately, the current plan doesn't do that. I also called for reversible lanes, as the council had years before, so that we have the lane capacity we need without overbuilding. As the Baltimore Sun noted, I've never simply said do nothing when it comes to 270 and 495. Instead, I've urged that we work together and come up with a project that addresses congestion without the excessive construction and the excessive costs that go along with it. I also agree with the Baltimore Sun that at this point it makes sense to wait on major decisions until we have a new governor in office. I'm glad that the Federal Highway Administration has recognized that a relatively minor delay now could produce a much better solution. This project is too important to our infrastructure, our economy, and our future, and we must get this right. Over the weekend, the U.S. Senate passed the largest and most comprehensive bill to combat climate change in our nation's history as part of the Inflation Reduction Act. We're still waiting to find out what this means in terms of funding for Montgomery County projects and its efforts, but this is progress. The bill includes tax credits to support electric vehicles, solar panels, and weatherizing homes. That can help individuals. As someone who drives an electric car and having recently installed solar panels in my house, the tax credits were a useful incentive, and I hope it will help move others towards cleaner energy as well. While we're thrilled that the federal government is acting, we've not been waiting on them. Montgomery County has one of the most aggressive climate action plans in the nation, with a goal to reduce 100% of our greenhouse gas emissions by 2035, 10 years ahead of the state's goals. On Sunday, I joined the volunteer street scientists to collect temperature data from their neighborhoods. As part of this urban heat mapping campaign, 115 volunteers from across Montgomery County collected temperature, humidity, time, and location data using heat sensors mounted on their cars. The street scientists covered an area of about 200 square miles of Montgomery County, encompassing densely populated areas like Gaithersburg, Germantown, Rockville, Silver Spring, Fairland, and Olney. Our effort is one of 15 campaigns taking place in communities across the United States this year. When it's complete, the information collected will produce maps and information that we can use to build resilience to extreme heat. Low-income communities and communities of color are often disproportionately impacted by extreme heat, and these local maps will help identify where we can take action to protect vulnerable communities both now and in the future. Final maps and data will be made available on Montgomery County's climate website and on heat.gov. Now on to the update about COVID-19. Case rates and the rising number of hospitalizations in our area linked to COVID continue to be of concern. Case rates continue to be above 200 per 100,000 people, and there are now more than 150 area hospitalizations. We remain in the high level of community transmission. Our hospitalizations are concerning, especially since so many of our hospitals remain short-staffed. This week, the Maryland Hospital Association reported a statewide shortage of 5,000 full-time registered nurses and 4,000 licensed practical nurses. This means that 25% of nurse positions are currently vacant. It's a scary situation, especially if we're to experience another surge like last winter. As our hospitals work to increase their staffing, we must do what we can to prevent individuals from becoming hospitalized with COVID. We continue to recommend the use of masks in congregate settings, as well as inside public areas like grocery stores and shopping centers. And even though we're about to reach 90% total of our population being fully vaccinated, our booster rates continue to hover below 60%. We need everyone who is eligible to get boosted. Routine testing is also important, and the proliferation of rapid tests has been very helpful to our efforts. This week we saw an increase in the number of free rapid tests to be distributed at Montgomery County libraries. Over 35,000 tests per week are being taken home. That's a significant increase over recent weeks and likely reflects many families going or coming home from vacations, as well as stocking up on tests for the return to school. Furthermore, if you picked up rapid tests months ago and are worried about the expiration date on them, the federal government recently extended the initial expiration date by 6 months. So if you've got a test that says it's expiring in September or October, add 6 months to that, and that'll be the actual expiration date. Most jurisdictions stopped handing out free rapid tests months ago, but we never stopped, and we don't plan to until we get this virus more finally and more fully under control. I want to continue to thank and appreciate our library employees, as well as our emergency management, HHS, and procurement teams for their work making rapid tests available. I'm pleased to announce that we now have Gaithersburg's own Novavax COVID vaccines available. Novavax's vaccine produced even fewer side effects in clinical trials than the mRNA vaccines. And this vaccine produces a strong immune response against all variants, including BA.5. The Novavax vaccine is a traditional protein-based vaccine, which differs from the other COVID vaccines. It's an important distinction because it was produced the same way as our flu shots, measles, and chickenpox vaccines. We hope this may encourage those unvaccinated in our county to give Novavax vaccine a shot. Anyone 18 or older who has not yet been vaccinated for COVID-19 can get the Novavax vaccine. It's a 2-dose series with the second shot given 3 weeks after the first. While it's not authorized yet for children under 18 at this time, Novavax says early studies in adolescents as young as 12 have been promising. Our DHHS is offering Novavax by appointment only right now. To pre-register for an appointment, please contact 240-777-2982. We will also be setting up clinics once we have a better sense of demand. Last week, the Biden administration declared monkeypox a national health emergency. Here in Maryland, there have been more than 200 cases recorded and more than 300 in the district. Nationally, there are over 9,000 people that have been diagnosed. As of now, federal health leaders in charge of our strategic national stockpile of vaccines are determining how many vaccines are available in each state and area. We have more than 1,300 people pre-registered for a vaccine, and by the end of the week, around 300 will have received the shot. Residents who believe they've been exposed to monkeypox should contact their healthcare provider or a community provider, such as an urgent care center. Those without health care provider or insurance can also call the Disease Control Program at 240-777-1755. Some of the activities that are known to spread MPX or monkeypox are kissing, hugging, massages, and sex. Sharing common items like towels and clothes may also be able to transmit the disease, but those account for a smaller percentage of cases. We're in the planning stages of a virtual town hall on monkeypox scheduled for Monday, August 22nd, and we'll have more details available soon. I encourage our residents who have concerns or questions about monkeypox to please join us at this important meeting. Great news for residents of the East County. This weekend, grocery shoppers got their first chance to see the new Giant Superstore at the Cherry Hill Orchard Shopping Center. The store will create more than 100 new union jobs and has already produced 2 donations for area aid organization. I want to thank Giant Food for donating $6,000 to the Manna Food Center and Impact Silver Spring as part of this grand opening celebration. Black women account for almost half of all infant deaths and fetal losses in Montgomery County last year. This is a statistic that we must address and correct. Towards that effort, Montgomery County's African American Health Program and other DHHS maternal and early childhood programs will host their inaugural Right from the Start event this Saturday from 10 a.m. to 1 p.m. at the White Oak Community Rec Center in Silver Spring. Attendees at the event will learn about healthy habits prior to becoming pregnant, racial disparities that can impact a healthy pregnancy, speaking up for yourself with healthcare professionals, The importance of maintaining your health and the health of your child through those early school years, developmental milestones in early childhood, and mental health help that's available. I hope you'll consider joining us at this important event. Finally, this week marks the start of the Montgomery County Fair, dubbed the 9 Best Days of Summer. Running from August 12th to the 20th, our annual agricultural festival features something for everyone. The fairgrounds are in Gaithersburg, and the fair is hosted by Montgomery County Agricultural Center, which has been in operation for close to 75 years. It takes more than 2,000 volunteers to put on the largest county fair in the state of Maryland every year. I encourage all Montgomery County residents and families to enjoy the fair. It's a great opportunity to get out, meet your neighbors, ride some carnival rides, pet some animals, and just generally have a nice day almost in the country. In the meantime, have a great week and talk to you again soon.